Hello everyone, my name is James and today I'll be giving a presentation on what I hope to gain and what I will contribute to the Keck Medicine Observation program if I'm given the opportunity. So firstly, I want to extend my thanks to the international program team at USSC Keck for firstly allowing me this opportunity to speak and have this round two of interviews. And also I'm very grateful for indeed for your time the other week in giving the long presentation and thorough presentation into teaching us a bit more about what the program entails and the various opportunities as well as missions of the program. And finally, a heartfelt thanks to Dr. Jubin Joseph as well for recommending me for this application process. So just a little bit more about myself. So hi, I'm James Zhang. I'm one of a second year resident doctors currently working in the UK near London. I personally grew up in Scotland in the UK and did my undergraduate and medical school both at University of Cambridge, graduating in 2023. I'm very passionate about internal medicine, research, and peer representation. And I'm planning to apply for the internal medicine match 2026 in the US. And outside of work, I'm an avid fan of the NFL and MLB and also collect and make custom sports cards myself. So, what do I hope to learn from this observership? So, this is a rundown of the three main points. Firstly, I want to learn more about the US healthcare system specifically, and as well as develop my passion for cardiology, which I have honed and further developed during my time at medical school as well as residency in the UK so far. And finally, I feel like it will greatly help with my US residency applications as well this year. So more specifically, I want to talk a bit more about my suitability and prior experiences having rotated and done work in the US healthcare system. So first of all, I've had good practical experiences having grown up and educated in the UK as well as worked in the UK healthcare system. There's many similarities to the US healthcare system with a focus on evidence-based medication as well as holistic patient-centered care as well. Furthermore, I've had good experience in the US so far. So during my elective in medical school about 3 years ago, I was in Chicago for a month of orthopedics, where it was both inpatient and outpatient in the OR and in the clinic as well. And finally, I did a clerkship in New Jersey Community Internal Medicine Clinic in May of 2025. So about 2 months ago, where I had hands-on experience in communicating with patients and working with members of the wider medical team. I've also had a solid theoretical foundation of knowledge, and where I've passed my the pass-fail USMLE Step 1 exam, and also I've scored 75th percentile in my Step 2 CK exam earlier this year as well. I'll be very grateful indeed for experience at such a prestigious university hospital such as Keck Medicine at USC to further enhance my hospital internal medicine experience. So specifically my interest in cardiology. So during medical school, I was the president of the Cambridge University Cardiology Society, and specifically during my early residency and internship year, I had a 4 month block in interventional cardiology here in the UK, in the suburbs of London. And I developed a passion into this field specifically, and since then, I've developed more experience in both research work as well as quality improvement work in this area as well. I've read about the world leading research done at Keck Medicine in cardiovascular health, and I want to further develop this passion of mine in this field. So now I'll talk a little bit more about what I think I will contribute to this program. So first and foremost, I feel like I have very good research experience, and I appreciate in the talk we talked about how in 1 to 3 months time it can be difficult to tangibly get research output. However, I hope to talk a little bit more about my personal experiences and my vision for what sort of collaboration, ongoing research experience, and collaboration can be fostered via this, albeit short, observership program. I also personally hope to apply to California area and possibly Keck Medicine as well for my residency and definitely my future fellowship applications as well. And so I hope to gain some experience, and I'll be very honored to gain some experience in this area. And a bit more abstract, which I'll talk about later, is I hope to establish links between Keck Medicine and UK physicians, and specifically my contacts at Cambridge University as well. Um, I'll talk specifically about the current landscape of UK medical graduates currently working in residency in the UK and how there's an increasing push to move abroad, and how currently the US is a very much untapped market for these graduates. Um, One specific thing I want to mention is I appreciate that the international program at USC, it makes a lot of the revenue from getting referrals from physicians from abroad. And I appreciate, because I am a junior resident still, in my second year, I may lack the physical capabilities of referring my patients directly to USC Keck, where a lot of the other older physicians or more experienced physicians applying for the program will have those capabilities. I want to be upfront with my limitations. However, I do hope to talk a little bit more about what I personally feel I can bring to this table, which is unique to myself, in the next couple of slides. So this is just a brief rundown of all the research papers I've published. I'll send the slides onto the submission portal as well. So if you guys want to have a specific look, please feel free to. I also have an email. I can answer any questions if needed. In summary, most of these research papers, I've got 26 papers currently. They were done throughout my time at Cambridge University Medical School, as well as in my junior residency years. And I have a strong background in clinical research over these past 5 years, and I have good specific skills in data analysis and research methodology and researcher design. I appreciate that if it's just 1 to 3 months of observerships here at Keck, it may be difficult to conduct studies. However, in my personal prior experiences, I've been able to do studies, number one, relatively quickly in just a few weeks' time from inception to finishing the manuscript. And the reason for that is I'm specifically very good at statistical analysis, which often is the bottleneck for a lot of the research, especially in primary studies and meta-analysis. And secondly, I'm able to continue research collaborations over a long period of time, even done remotely. So an example is with my main supervisor back in Cambridge, who's an orthopedic surgeon and professor. I've, even despite in my first 2 years of residency being away and rotating in different hospitals, I've kept up that working relationship, as well as helped lead in many research groups, leveraging my experience in study design as well as statistical analysis and publication skills as well. And so you've given the opportunity to get to meet people at USC Keck. I feel like even if I am to come back home after the observership, I'm able to sustain research output in the coming months and years whilst continuing to work with USC Keck medical faculty members. So that's my research experience. A little bit more about my leadership and management experience as well, which will tie into my next point. So specifically throughout my undergraduate medical school, as well as being a resident, I've held a variety of leadership and management roles, including doing an intercalated degree in management studies at the Cambridge University Judge Business School in 2019 and 2020 academic year. So I've only put on here the roles where I was year representative or society president. However, in between these roles, I've done a lot of other committee work as well. So specifically during my undergrad years, I was voted multiple times as the year lead, and throughout medical school, I was president of several large societies as well. And now as a resident, this year specifically, I was the deputy postgraduate year 2 resident representative in the whole East of England region. And throughout these roles, I've gained a lot of experience in both management and leadership. But more importantly, I think to this topic, I've had the connections and ongoing working relationships with a lot of faculty members, as well as current students and current resident doctors. And throughout these, I'm able to have a large group of people who I'm able to give advice on, as well as give information on specific pathways. So specifically talking about this aspect, so in the past couple of years in the UK medical graduate pool, there's an increasing desire to move away to possibly other countries after finishing first and second year of residency, where we call foundation year residency. And the reason is, in the past, I would say 10 to 15 years, there's been a deterioration of working conditions, training opportunities, and pay stagnation, such that currently there's quite a lot of union activity as well as industrial action. In fact, the next round of strikes in the UK for doctors, it's the 25th to the 30th of July, just announced yesterday. And given this current trend, there's quite a lot of UK physicians in the past definitely 5 or 6 years, moving abroad to places such as Australia or New Zealand. However, in the US, it's still very much an untapped market, mostly due to the extra exams that we have to sit, but also the lack of contacts and lack of direction overall for students wanting to go on elective, for instance, to gain more experience into the system, as well as applying for residency as well. So for me personally, having a strong network, being the president of many societies back in Cambridge and still having those student connections, as well as to the various faculty members, such as to directors of studies or professors, but also my regional residency representative roles as well. I feel like I have access to a large pool of UK medical students and resident doctors in my network, and I'm able to promote USC opportunities as well. For instance, electives during medical school. An anecdote is back in about 3 years ago when I was still in Cambridge and doing my medical elective, probably less than 10 people were going to the US for elective in a year of about 250. However, in this past year, from some of my friends still in medical school, that number has drastically increased to about 20 to 30 people. And so, given this increase in numbers of people and the lack of connections that UK universities have to US universities, I feel like there can be much more spreading of the good name of USC to these students, and they can arrange these electives with your program, for instance. Furthermore, research collaborations is something which is becoming more important since post-COVID, and indeed, a lot of my research now has been either international collaborations or national collaborations in which most of the work is done remotely. And so I feel like there's a large gap in the market for a lot of UK graduates, especially my home institution of Cambridge, in which there can be connections set up with USC. And finally, with future residency applications as well as fellowship applications, I feel like getting the name of USC out to these prospective people who are planning to move to the US or apply to the US residency system is very important as well in this collaboration. And finally, the longer term benefits is that even if these students don't directly go and work for USC or in the California or US area, then futures attendings, these students who've collaborated with USC or have done programs with USC due to this spreading of information, when they become future attendings, and hopefully with the continued success, which I'm sure will happen, of the USC International program in the coming decade or so, there will be more referrals of patients and more collaborations in those aspects as well. So those are the specific things I hope to contribute to USC, leveraging my experience and network of students in the UK environment, especially in Cambridge University, as well as my roles and connections as part of my residency doctor representative roles. So thank you very much indeed for considering my application and for listening to my talk. I'm very grateful indeed for the opportunity to discuss a little bit more about myself, as well as what I hope to learn and contribute to this program. This is my Cambridge Alumni email. If there's any questions at all about my presentation or my application. Thank you again very much indeed for your time, and I hope you guys have a lovely day. Thank you.